Sasha. So the purpose of this today is we're going through a adult pre-screening exercise questionnaire, just to get a bit of idea about what your capabilities are, what your level of fitness is, any risks that you have, so then we can make an informed decision about an exercise program from you and what's right for you.
Yep.
Does that make sense?
Yep.
Excellent. Cool. Right. So what's your name, Sasha? Desmarais?
Demarais.
Demarais, I get it wrong every time. Alright. So the aim of this is to identify individuals with a known disease and signs or symptoms of disease that may put you at a higher risk. So by the end of this questionnaire, we should have a good idea of what your level of fitness is and what your level of exertion is, and write out a program that suits you for what you need to do.
Sounds good.
Okay, a couple of questions we'll go through in stage one, get an idea of where we're at, and stage two on the other side, flip it over pretty quickly and get through it.
Right.
So have you, has your medical practitioner ever told you that you have a heart condition or you ever suffered a stroke?
No.
Do you experience unexplained pains or discomfort in your chest at rest or during physical activity and exercise?
No, I don't.
Do you ever feel faint, dizzy or lose balance during physical activity?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No, not at all.
If you have type 2 or type 1 diabetes, have you had trouble controlling your blood sugar? Do you have diabetes that you know of?
No, I don't. Okay.
Have you had any other condition that may require special consideration for any exercise?
No. All ready to go. So, describe your current physical activity and exercise levels in a week. So what do you do? Do you exercise at the moment? Yeah, I'm exercising around about 4 to 5 times a week.
Okay.
Yep.
And is it sort of like a light exercise, moderate or high intensity?
It's moderate to high.
Moderate to high, so... And how many minutes do you train per session?
Between 45 and an hour.
Okay, yep. So that's quite a lot of exercise, 180 for a week. So if you're doing that at the moment, you could probably qualify for something high intensity or moderate to vigorous. We just need a little bit more information.
Yep.
So stage 2, this stage is to be completed with me to determine the appropriate exercise prescription based on established risk factors. Okay, so what's your age?
I am 45.
Male. So is there any family history of heart attack, stroke, or anything like that?
No.
Nothing at all? Nothing at all. Do you smoke cigarettes on a daily basis, or have you quit smoking in the last 6 months?
No, I don't smoke.
At all?
At all.
Yeah, good. Your body composition, weight in kilos. We just weighed you before, so what was that?
Yeah, that was 85.
84 kilos. And your height?
Yeah, that was 185.
So your body mass index based on that, get the calculator. We calculated that to be you spent time in hospital, including day admission for any condition during the last 12 months?
No.
Nothing at all?
No.
Good. Not pregnant, obviously. We have to ask that question.
Never.
Do you have any diagnosis for any bone, muscle, tendon, ligament, or joint problems that you've been told get worse by participating in exercise?
No, not at all.
Okay. So now, this is like a profile form, just to get an idea of what you like to do and get an idea of what's going to fit you to, we can write your program up to suit you so you actually enjoy it as well for the most part.
Yeah, no, that sounds good.
So how long do you like to exercise for? You said around about...
Yeah, up to 60 minutes. Yeah, which is good.
Okay. What time of the day do you prefer to exercise if you had a choice?
If I had a choice, morning.
Mornings?
Yeah.
Morning person? So I think after 6 weeks, you said that you want to do weights and bodybuilding. So
Yeah.
I think with the 6 week program, after that you'll start noticing significant improvements in your lifting. And after 6 weeks, hopefully you've mastered this exercise program. You can increase your weights and then reassess your goals as you're progressing.
That'd be great.
Good. So with these goals of training and improving your appearance and like that, how committed do you feel you are? Is it extremely pretty focused somewhat, or?
Yeah, look, I'm pretty focused. You know, the fact that now I'm going to get a program, I think it's going to help me keep more accountable and also have an understanding of like what to do before it was like I was coming in.
Goals to increase lean muscle mass.
Yes, that's right.
Okay, so just to get an idea of what you're sort of eating at the moment, so we can break down where you're sitting nutritionally,
Yeah.
what we can do. What's your typical breakfast sort of look like?
Oh, you know, because I try to get to the gym early in the morning, I just started the day with coffee.
Okay,
Yeah, because I just
coffee,
coffee. I don't really have breakfast.
You don't?
Yeah, I kind of skip that. Most times I probably should have more breakfast,
Yeah.
but you know, because I'm trying to get into the gym quickly.
Yeah, it's,
don't like
it's
to
a pretty
eat.
common thing.
Yeah.
Okay, yep. All right, and so around about lunchtime, what do you sort of have there?
I usually go to Subway and get a footlong.
Yep. Okay.
Yeah, which is good. And I have you know, sometimes I'll have a cookie with it.
Oh, really?
Yeah.
Okay. Yep.
And then maybe a soda.
Yep. Okay. Yep. And that's pretty much every day. You sort of do that. sort of
Yeah, pretty
routine?
much. You know, it's near my work, so it's easy for
Convenient.
me to go. Yep.
Got it. Okay. And what's a typical dinner look like?
For dinner, it's usually like pasta